because I can't speak Malayalam.
In English.
So we have this.
So I can either speak Hindi or English. I know Hindi you may not appreciate, so English is the best thing to do.
Sir, you come here. Direct.
Very humid.
You are the director. We are all outsiders.
So please, you have to be in the center.
मैंने पहले बोला था आप
अरे इनका you have to take his bite only.
So we have this.
no big bite from him and a smallest bite from me. That's all in between.
Yeah. Then even smaller from me.
No. I went to the smaller, so you have to be in between. First of all, can you introduce each one of you? Hindu. Aap?
Anish from Janmabhoomi Daily.
Janmabhoomi. You, madam?
I do Krishna from Doordarshan.
Doordarshan. Anybody else?
They are from Kerala comedy, sir.
They are photographers or photojournalists? You are photojournalist or photographer?
Newspaper Kerala comedies.
Okay, okay. You know what happened today?
Yeah, I did the competition online.
So you were there recording the entire proceedings.
No, so I'll just give you a small background of how it works, because Sree Chitra is an autonomous institute of national importance under the Department of Science and Technology. And Dr. Karandikar is the Secretary of Science and Technology, Department of Science and Technology, and he's also the previous director of IIT Kanpur for 5 years. So basically, Department of Science and Technology controls the way Sree Chitra and 32 other institutes work. And then Dr. Saraswat is the president of the institute. So actually everything which is done, the governing body, the institute body which is held, is under his here. And because it's an autonomous institute of national importance, so almost 80% of the work, there are some guidelines which we have, and on the basis of the guidelines, the governing body and the institute body actually conducts everything. And Sir is the president of the governing body, institute body. And of course, we have Dr. Narayanan, who's the director of the
LPSC.
the liquid propulsion lab of the of ISRO, and he's been responsible for the cryogenic fuel and also the solid fuel in the engines and all the technology which is developed from it. And in fact, in the Chandrayaan thing, how it will be manipulated, how it will be turn directions in space, everything here is there. And Dr. Shiv Sareen is an eminent gastroenterologist. I think from India, he's the #1 gastroenterologist of the country. And he has been he's also the president of the National Academy of Medical Sciences. And I think almost every important discovery of gastroenterology from India, he's been responsible for it. And he's also been in the National Medical Council. All this NEAT and NEXT, everything which came because of him and his ideas. So that's the very illustrious group of people we have. So please know.
Starting today morning, you mentioned two things. One was the Center of Excellence in Minimally Invasive Cardiovascular Devices. So that is.
That is in the. It's coming soon, very soon. But more than that, there's a Center of Excellence for Heart Failure. It's an Indian Council for Medical Research project, which is already we have.
This is going to come up.
This one is just going to come. I mean, it's in the stages that they will give the final ratification and all that. That is going to come.
And the second thing that you mentioned was the second generation that has been implanted.
Yeah, so it has been implanted in almost 42 patients, and there has been no complication.
When was the first one implanted?
This is almost, I think, 25 years ago. 25 years ago. The first one, Dr. Verma will say. Dr. Verma is the head of the biomedical technology.
The first generation was in 1990. The first.
The first generation. So this is
Second generation. I was in the second.
Professor Verma is the top.
Yeah. So we actually had mentioned that the second generation that has been imparted in 42 questions. So when was the first second generation? That was 1 year back. 1 year. Within 1 year.
And Dr. Srinivas and Dr. Koshi are both cardiac anesthetists. So it was done under their presence. So I think you can give more details.
So it's 42 patients.
Yeah, 42 patients. And there will be no complications. So now we are making it into a multi-centric trial. We are making it into a multi-centric trial.
And the Center of Excellence, when are you planning to have it?
No, the heart failure started this year.
This year.
And this one, we are waiting for the final papers.
So you spoke about the importance of translational research and basic research. So we are also facing a situation where the Covishield vaccine is facing a lot of concern now. So what is the government? There's also a petition in the Supreme Court which is seeking a team to study this thing. So what has the government done after?
No, all our vaccines which have been done, all have been widely tested and cleared by ICMR. All, I'm not talking of what you probably are referring to that AstraZeneca problem. No, it has nothing to do. As far as we are concerned, our vaccines, whether the Covishield or Covaxin, both of them have been certified clearly and no such side effects have been reported, at least in the Indian population we have done. We have even exported these vaccines to various other countries also, and from there also we have not had any problem. I don't want to comment on what has been identified by AstraZeneca and things like that, because that's beyond we don't have the database, so we don't want to comment. But as far as our vaccines are concerned, they are absolutely safe and there is no doubts as far as their efficacy is concerned.
But now one family has approached planning to file a complaint saying that the daughter died.
No, these kind of isolated reportings have been done even in those days. But later on verification, all cases, even during when the vaccine was being injected and popularized, there were one odd cases where people reported certain incidences of adverse impact. But later on, all verification by the expert doctors and everybody, it was found to be a false alarm. It was due to some other reason that particular disease occurred, nothing to do with the vaccine.
So you spoke about now engineering and medical research coming together. Can you elaborate on that?
No, actually, if you see most of the medical institutions in our country, they are, most are standalone medical colleges or medical institutions, including, All India Institutes of Medical Sciences. But increasingly now we are seeing that there is a strong interplay between the science, engineering and medicine, particularly for advancing the research in medical sciences and technology. So Sree Chitra has been unique in the sense that this is perhaps, though historically the only institute which has clinicians and engineers or biomedical engineers working together under the same roof. So that is important because there are many institutions, medical institutions and colleges which are working closely with engineering institutions and biomedical engineers of or IITs differently. Like for example, AIIMS working with IIT. There are plenty of such examples. But under the same roof, in the same institution, this is perhaps the only institution where biomedical engineers, mechanical engineers are closely working. And that actually has led, as you saw, that technology development and also this year like transfer of 8 technologies and other things. So we need to do more in that direction because we have a very capable pool of very highly qualified and very expert doctors and medical clinicians, and we also have a very strong pool of very strong engineering scientists and technologists, and they need to work together more in order to do better advancements in medical education, where India can take the lead, not just in clinical care and patient care and providing health care, but also in developing the technology and leading the health science research. So I think that, so maybe Sree Chitra type more institutions, I would say, are needed, or we need to have a more close knit collaborations between scientists, engineers and medical doctors.
Is there a concrete program to promote that?
No, I mean, this is just this is like my personal thought. We don't have any sort of a right now program, but I should tell you that some institutions have taken the, for example, Indian Institute of Science.
40 years.
Yes. Yeah.
You still call it unique now. 40 years later also you
Yeah, it is true that, even we have not, although I know that Indian Institute of Science Bangalore has recently initiated activities that they are also going to medical school. In IIT Kanpur, when I was there, we have initiated that activity. So some efforts are happening, beginning to happen, and all I'm saying is that we really need more concerted efforts of bringing together scientists and engineers. Also, as you know, advances in technology like artificial intelligence, again, telehealth, etc., have sort of rapidly advanced, and they are also coming into the healthcare. So a more knit collaboration is definitely needed.
You also spoke about Trivandrum. So can you say something?
No, I'm just saying that in any healthcare program or policy, also in hospitals, this emphasis on.
Do you think that we don't give that much emphasis?
As much as needed. I mean, we do give, but most of the time, I think the doctor's time is mostly spent in treating the patients all the time. That is also because, there are large, because of our population, there are large number of patients and less doctors. So doctors' times are spent more on treating the patients and performing the procedures. But we are not built in our systems for a overall framework for a preventive healthcare where less people fall sick. By the way, this also not only has a doctor to play, it has some technology to play. It has also other factors, like you need less pollution. So there is a place where, there is a role for, reducing the pollutions, for providing clean water, sanitation. So all those are also there for preventive healthcare.
For example, head injury.
Yeah.
Supposing if you only focus on treating head injury, that's not an effective profession. If you make the roads broad, if you make sure there are lanes in the system, then automatically head injuries decrease. So it's a very important.
Yeah. Also, for example, I think everyone today, as you know, talked about living up to 100 years of age, and likely, I think India population, will by 2047 will also become an aging society. Our, median age will go up. And therefore, to address the aging society, also we need to take care of the technologies to develop, the assistive healthcare and the preventive healthcare in order to address, the challenge of an aging society maybe in the next 25 years or so. So that also should be in the plan of a overall healthcare system and not just, opening more hospitals is what I'm.
You heard Dr. Sareen's talk. He talked about preventing only. He gave so much illustrations by showing what we should eat, how we should live, all that very important.
You mentioned about the aging population.
Yes. Yes, sir. I think we are talking of 2047 when India will be 100 years, but overall, right now, India is India is a young country but in 25 years it will no longer be, it will face similar problem with countries such as Japan or others are facing, and we therefore need to be prepared.
In Kerala, for instance, the youngsters, most of the children are outside, the parents are.
See, once upon a time there were no hospitals where geriatric care was being worked upon. today slowly in India also, we are having like AIMS as a center today of geriatric care where people above 60 can go and they can take care of. So the population as it is, you will need more and more such facilities. But before you age, it is better that you age healthy manner so that you don't run into the requirements of a geriatric care as we have it. Prevention is better than cure.
That's the other point I was just mentioning about engineering and technology and medicine. See, in a country of our 140 billion population, we need to use the technology to scale the healthcare. I mean, you can't, as you know, today the doctor-patient ratio in a country is less. Now, you can't be producing so many qualified doctors to reduce that gap, or you can't be building so many physical hospitals. I mean, you can build a hospital, but you need more doctors. Yeah, but so therefore the use of technology in scaling also is very critical in order to provide affordable health care. I mean, affordable health care you cannot provide by building several. If you can build hospitals, but then you need doctors to man the hospitals. I mean, and then you need even more the paramedical staff also. So this is I think so. Therefore, we need in a country like India, we also need appropriate use of technology in scaling the healthcare.
So a very important point was made by Dr. Sree on how your diet actually not only influences the liver but also brain and heart. So I think, sir, if you could just expand on that.
I don't want to hurt you people. Am I saying you will all say, what a doctor, he spoiled my day. Are you interested in this?
Everybody is interested in that.
He doesn't want to frighten me.
Yeah, I know.
No, but actually it's a very important point that you mentioned that we don't even realize that we are developing fatty liver. And once fatty liver develops, then actually the work on liver increases. And once the work on liver increases, then it actually causes atherosclerosis formation, it causes stroke, it causes heart failure. It actually it's a silent killer and we don't even know about it. So that's what it is. And we think that only an obese person has fatty liver. It's not only an obese person, even a thin person can have a fatty liver. So that thing is not. So if you could
What would you like to know?
No, the fatty liver, what you just mentioned, at least up to now, I think the general conception is that those who take alcohol, they are going to have or can you just tell us something about it? What exactly?
So, fatty liver is where your liver has more fat than 10%. And everyone can diagnose fatty liver without going to a doctor. One person is overweight or obese, or has diabetes, or has blood pressure, has high cholesterol or triglyceride, or sometimes the young girls have polycystic ovary, has gallbladder stone. There are 10 conditions. So if polycystic ovary, it means you have fatty liver. This is in general. Number 2, if your family, anybody, father, mother, brother, sister, ancestors have this, then you are very prone to get fatty liver. So you can self-diagnose if you are born you can't choose your mother. You're born. Mother is diabetic and you're born in a family of diabetes. So what can you do? You know you are a defective piece. Have you got the point? It's very hard hitting.
Genetic problem.
You got a defective piece. So मारुति है गलत बन जाए तो वापस ले आते और नहीं वो फोर्ड ने बनाई 2 lakh cars are taken back, but you can't take back the human body. You're born. So if you are a defective piece, you must know you are a defective piece or a manufacturing defect. If you are a manufacturing defect, means father, mother had blood pressure, heart disease, any of this. So now you know what you are and what your children will be. Because you are going to make more babies. So first message is to do fatty liver assessment, self-assessment. Are you born in such a family, or you are yourself suffering from obesity? And a very simple rule, if you can teach Kerala people one thing: height minus 100 is your. What is your height? 163 centimeter. And what is your weight?
68.
So you have 5 kg extra. Then if your parents had blood pressure or diabetes, you have to remove 5% more, 5 kg. So the moment you are above, so you are overweight, so you have fatty liver. The methods may not detect it, current methods, but in very